Good morning. I'm here and delighted to welcome a good friend of mine, Bruce Bernstein, from Carrington, and he's here in Tampa. We've been trying to coordinate this meeting for a little while, but I was excited when he decided to come finally in our studios to talk a little bit about what Carrington is doing out in the dental space and how they're making it easier for patients, especially uninsured patients, to receive treatment and how they're helping dental practices all across the country to really serve their community. At the end of the day, our goal in dentistry, no matter whether you're a dentist or whether you are one of the companies that are helping dentists like us, is to get more people to receive the treatment that they deserve so that they can lead the lives that they want. And that's the purpose behind us creating Patient Prism. It was not meant to be a software company that did call tracking. Our goal is that here's 30% of phone calls that are not getting booked because there is some impediments that are created at the beginning that prevent the patient from making that appointment. And one of the biggest impediments that is there is its price, right? Patients are worried. Most of the patients don't even call a dentist because they're worried that they can't afford it, number one. And not everybody has insurance. And if they do have insurance, there's some limits for that. And then people, because there is the perception that dentistry is so expensive, people don't even know what options they have out there that could require them least amount of dentistry. If they only did maintenance, right? If they went to their hygiene checkups every 6 months, right, and they kept their mouth healthy, they would need less dentistry, right? And I think Careington has been around for a while in this space, and I think they're making. I think you have you were telling me, how many million members are you guys at now?
Have over 11 million members in the United States, and we're even in the United Kingdom as well, with a few 100,000 members there. So we've taken this model and expanded it into Europe, where these programs that we offer help anyone afford the dental treatment that they need, and like you said, Amal, that they really deserve, and it's about quality of life.
So tell me, for dentists who haven't heard about Carrington yet, most have, but there's lots of new graduates coming out. There's new practices being formed. What was Carrington originally in the dental industry? What was their purpose, and
right,
why did they exist?
Two dentists started Careington in the Dallas-Fort Worth area. They owned about 8 dental practices, and they started going to the local school districts, the cities nearby, and said, send your employees to our dental practices, and we'll give them a discounted rate on their treatment. And that was at a time when, before dental insurance, dental HMOs and PPOs were really popular, and so it was, again, a way for them to fill their empty chair time and help patients afford the treatment they need and convert those treatment plans. And so, we understand as a company, Careington, that we need to serve all parties, and that starts with the dentists who participate in our network, and then we help drive those 11 million members into their practices. And the beauty of discount dental plans is that they're not insurance, and so the patient receives a discount, which you're going to provide them anyway to help them with that treatment plan coordination. It doesn't cost the dentist anything to be a part of our network. You simply meet the credentialing standards, and
Sure,
you're already doing those things. And then it's about getting those patients into the dental practice, and they pay for according to the discounted rate at the time of treatment. So there's none of that insurance headache and administrative tasks that it's amazing when we moved into the UK marketplace, where dental practices don't file claims to insurance companies.
absolutely.
They have at least half the staff up front. In America, these dental practices have to have staff, 2 or 3 people that just deal with insurance. And so that's one of the beautiful things about discount dental plans.
So if I'm starting a dental practice and I have a book of business, what do I need to do? So if I need to get Carrington in my office, what happens? What are the steps? What can I do to get Carrington? And then what do I offer that to my patients? Do I tell them? Do I, as a dentist, tell my patients that, hey, this is something that you have available to you? You guys can sign up. How do patients sign up for Carrington versus how do dentists sign up for
Right.
Carrington? Does a dentist have to sign up first and then the patient signs up, or it can happen independently?
So we have quite a few different models, really. The traditional Careington discount dental plan model is that the first step would be for the dental practice to complete some forms and an application. It's really not, it's a 30-day opt-out, so it's super easy to try out, and if you have any issues with it, you can always opt out quickly. So it's not a long-term agreement like there are with other companies. And then the patients that are Careington members, we get those through many different methods. So
Okay.
traditionally, we were really embedded with non-dental insurance products, so through health plans,
Sure.
or maybe Medicare Advantage.
Oh, wow.
Those are really, really popular because Medicare Advantage typically does not cover dental treatment.
Dental treatment. That's right.
So the policy's not paying that for the member anything. And so, that's the time of your life when you're 65 years old or above when you need the majority of your dental treatment. And
Sure.
most of those folks these days have had dental insurance from their employer their entire life. And they reach the age of Medicare and they all of a
Don't have
sudden
anything.
don't have anything when they need it the most. So those have been some of the methods. More recently, I'm excited to say that these big employers have started offering discount dental alongside their dental insurance options to their employees. This month, American Airlines, we just went out and met with all the employees at the enrollment fairs. And so over 100,000 employees are going to have that option, and they've already started to sign up for that program. So that's the benefit of a dental practice as being part of these programs is we're going out and finding the patients for you, and we're bringing them in the door. But there is another side to that you asked about, Amal, which is, what about my existing patients? And if they can't afford treatment, they don't have insurance, what do I do? And yes, you could definitely sign up to be part of Careington and then offer the Careington plan for them. But there's something really exciting that's going on in dentistry right now with patient loyalty plans, and that's really one of our newest models that it's exciting for dental practices to hear about this if they haven't, because the difference in selling your patients a Careington plan and creating your own patient loyalty plan is that
Okay.
you get to make an impact on what do you want to charge the patients, what discount level do you want to provide. And it's exclusively available in your practice. So it's truly a loyalty plan. It brings that patient back. It brings their family in because they're paying a monthly or annual membership fee
Sure.
to get the discounts and anything you really want to build into the loyalty plan to make your patients more loyal and willing to see.
One of the things we talk about at Patient Prism is patients falling off from the top of the funnel, but a lot of times, a lot of dental practices don't know how many patients are falling off at the bottom of the funnel, which is, you've treated them and they're not coming back. And wouldn't it be great to have something that keeps them coming back? The loyalty program sounds interesting because now people talk about it. We have how does this plan work in terms of a dental practice decides to implement their own program,
Right.
which is it backed by Carrington?
Yes, if they work with Careington, one of the important pieces and reasons you'd want to work with another company as opposed to trying to do it all in-house yourself is that there are regulations across the United States. There are federal consumer protection laws, and there are state laws typically governed by the Department of Insurance, even though it's not an insurance plan.
Okay.
Department of Insurance has regulations in place. And so in some states you have to be registered, in some states you have to be licensed. Other states, there are specific rules that say here's how you can describe and market your plan, and here are the things you can't say. Most importantly, the Department of Insurance doesn't want a practice offering a plan and making the patient think that it's insurance. So they want you to use terms that keep you away from it. The beauty of working with Carrington is we are a licensed DPO all across the United States, in every state where it's required. Plus, we know all the federal consumer protection laws and things that you can't do from a marketing perspective. So when we administer a plan for you, and we'll completely private label it, put your brand, your practice, you choose the name. But we, in the fine print, Careington is the discount plan organization, DPO for short, and you get that big compliance team that we have back in our offices that are taking care of this. And if we were to do something wrong, we would be on the hook, not you. And in some states, like right here in Florida, dental practices have been shut down by the state, by the dental boards, because they had a discount dental plan in their practice that was not compliant.
So this is kind of in the box. If you want to implement a discount plan for your patients, they can just sign up with you guys. You will provide them the infrastructure with some marketing help as well, in terms of like creating, like, okay, here's what we want to do with it. And so your team works with the dental practices in crafting a particular plan for their patients?
Absolutely. So we have a website, launchedloyalty.com, where a dental practice can go there and build their own plan from scratch. And part of that includes the marketing. And so you will design your own website that is just about your patient loyalty plan, and including choosing images and color schemes that go in line with your logo. You upload your logo, and so the website's key. We also have brochures and posters that we send to the practices. They put those up in the waiting room with a brochure sent, and they can pass those out to the patients and talk to them about it. And everything directs them to that website, where the patients can also then enroll in their patient loyalty plan.
Can that be integrated with the patient, with the dental website as well? Can you put the plan as a landing page where they click on, let's say my company is called, New Smiles Dentistry, and can New Smiles Dentistry discount plan, can it be a landing page where they can just enroll in that through your back-end systems?
Absolutely. So on the dental practice corporate website, there can be a link that opens a new window that becomes the landing page for the discount dental plan, or they can embed it into their site.
Okay.
We really get it SEO ready and provide some of that. So if it is linked into a corporate website or embedded in, that certainly helps from an optimization perspective.
So talk to me about, and you talk to hundreds of dental practices all the time, and what intrigues me about what you said about American Airlines is very interesting, because now you're saying that corporations now are offering dental discount plans in addition to the insurance plans, because obviously insurance is great, but it's not enough, right? It doesn't get you all the things you need. Plus you need a lot more things going on, and why not have an add-on to your dental insurance? So what have you talked to dental practices who said, man, this is great, because now our patients have not just one choice, but two choices. They can come in, they can utilize their insurance, but now they can also, that's done, they can utilize an insurance plan, a discount plan that gets them to do more treatment. And that eventually helps, obviously, build their patient revenues. It also helps patients, like, hey, man, my dentist is actually trying very hard to help me, afford the treatment. So how has that worked? Those having two things in conjunction, having an insurance as well as the dental discount plan. What does it do to dental practice in terms of their top line revenues? Have you seen some great case studies? And I'm sure you have.
Yes, and that's one of the ways that the discount plans can be used, being for insurance patients who exhaust those benefits throughout the year. They've reached their maximum, or maybe they want orthodontia for their kids, and that's not covered by their insurance plan. or simply they have a waiting period because they're new to the insurance policy and certain things aren't covered for the first couple of years.
That's right.
There are options there where that discount plan can be utilized. And you're absolutely right. The conversations we've had with dental practices is that they'll say, the type of treatment that a patient can now get performed within 1 year is much greater than it was previously, because we understood the plight of the patient. We wanted them to be happy, and so we would say you should probably just wait until next year to get these benefits done when your insurance kicks back in.
Correct.
And that's trying to provide best customer service for your patient and do what's best for them, but it does hurt the dental practice from a revenue perspective, and this really will make a big difference. The other thing is the patients pay a recurring fee, whether monthly or annual, semi-annual, a membership fee to be a part of the loyalty plan, and a large portion of that goes to the dental practice every month. So it also creates this other revenue stream for the dental practices.
So if I'm the patient, so I can go in and enroll in Carrington discount plan, right?
Right.
And then I can look at the list of providers that are out there that provide, and I go to the dental. So let's say I'm paying a fee to be part of this plan. Does part of that fee go to the dentist?
It does when we design a customized plan for the practice.
Oh, customized plan.
So separate from the traditional, more Careington model.
So if they're part of the launch loyalty, is the launch loyalty the customized plan?
Yes.
Okay.
Launch loyalty is a customized plan. You go to our website, you design your own plan, and you do it all from scratch, basically A to Z, and then you have your own plan there. And so then the patients pay that fee. Carrington collects that because we're PCI compliant, payment card industry compliant, which means that we can take that payment information and do a recurring fee. So just like the Amazon Primes and any other subscription type model, that's really important because, again, going back to the compliance piece, you hear about the breaches. I mean, now our
everything is breached.
Social Security numbers have been breached from a system.
We got
right?
Equifax breach. So
exactly, and so even a dental practice, if they had one credit card that was stolen from their database or it was written down in a filing drawer somewhere, those are $1 million fines each. So again, Carrington takes those things off the table for the practice. They don't have to worry about it. But a portion of that fee that we collect, 50% of that goes to the practice. So
it's pretty incredible.
Yeah, and that's a nice additional revenue stream, like I said, and it gets those patients now coming back. Because if you provide a patient who doesn't have insurance and they're cash paying a discount when they come in, they just see that as your new UCR for them. But if they're paying a membership fee to get certain benefits, they understand that model, like an Amazon Prime or like another like a Netflix, right? They're paying a fee to get.
You make an interesting point, because the moment you get a Prime membership, you kind of are intertwined with the Amazon's model, where you kind of say, oh my God, shipping is free, it comes in 2 days, let me order more things from them, right? And I think people have started using Amazon more because of Prime membership. And I think that model applies really well in your space, because if you have Careington membership, you're going to use it more. You're going to obviously utilize the features because you want to kind of see whether it's worth it. I mean, you want to get your money back, right? You want to make sure that you utilize the benefits of the membership.
That's right.
And it prods the patients from actually calling the dentist more, because now they have a benefit that they want to utilize.
Right.
That's very interesting. So are dental practices trying, is that one of your efforts at Carrington, to try to get dental practices to get their patients to be part of this program?
Yes. Corporate dentistry's been offering these patient loyalty plans for some time now. We're seeing the independent practices try to do it themselves as well, and it's a difficult proposition. But when they work with us, and as you correctly stated, we help from the marketing side of it as well.
Okay.
That helps, get more patients in the practice, because it's mainly a driver for those folks that can't afford a treatment plan that you put in front of them and don't have insurance. But there are other areas where it helps, and through that online presence, we can also add on to it more localized, paid for pay-per-click advertising,
Okay.
banner ads, and all of the online digital marketing services, to take it from being a solution for existing patients to becoming something that drives new patients into your practice.
Do a lot of dentists, when they look at you're saying you acquire patients from all different sources, including Medicare Advantage plans. So dentists now have another channel basically to get their patients from the insurance, from your list of patients.
Yes.
What kind of support that you guys provide dental practices who really need help in communicating this message to their patients? Is it done through emails, or would you help like if it's a DSO and they have several offices, would you go in and kind of help them put this in place, a program in place, and help all the people kind of? There's one thing, you can get a program in place and never use it, right?
Right.
And you can always sign up. We always sign up for all these things, but if we don't use it to our advantage, it's no good. So what's the implementation like in terms of, let's say there's a group of 10 practices and they want to have a program in place where they're marketing to their patients, saying that, hey guys, we have this discount plan in place. Is there support from your team to help them kind of get it across to the patients?
Absolutely. So, part of the process with Launch Loyalty, it starts with, what do you want your plan to look like, and branding, and all the typical implementation to design it. Then once it's designed and we create all the marketing materials, our Launch Loyalty team would, in that scenario, 10 practices, we'd go out to wherever they're located and do face-to-face meetings with the office managers of those locations, any treatment coordinators that they have on staff, insurance coordinators, really all of the staff, to explain the value of the plan that your owners just designed and created. So we train them about the face-to-face interactions, and then we talk about your patient files. And so, who do you have out there that has become dormant, and how can we interact with them? So we'll help design the marketing message, and then typically the practices have their own system in place to either do SMS, text messaging campaigns, or email, and that's a big part of it. And then just the online experience. And so our base offering is really comes with the website. We host it. All of that is included, and then for additional setup, what we'll do is those digital marketing pieces, and that helps get the word out to their existing patient base, yes, through their corporate website, but hopefully to the community at large around them.
That's very interesting. You're helping with patient reactivation.
Absolutely.
Quite a bit, especially with the treatment plans that have been sitting around gathering dust for all these years. You're helping them, guys, okay, we have this, and this is what, because most of the time, only if you communicate it better to the patient that, hey, we have something special coming up, whether you're sending them a newsletter, whether you're sending them an email, and we've tied up with whoever it is, and we have special discounts available, and you kind of run a list of all the patients that need crowns, for example, and say, this is the plan we have in place. I think you might get more of these people to say, hey, this is a great deal. I want to be part of this.
That's right. I mean, you can only send the dormant patient list an email about free whitening campaign that you're running so many times per year. You need something new and different to bring to the table, and bringing your own plan where it's just between the dental practice and the patient. that we've seen that's really changed the conversation with those patients that they haven't seen in quite a long time. And so, as you said, there's treatment that needs to be performed, and this is a comprehensive loyalty plan that will help them with any of the treatment they need, afford the care. And so it is a compelling message to that patient.
It truly is pretty incredible, and there is still, I mean, no matter, you guys serve a lot of dentists across the country. I think I see many dental practices just don't know how to utilize you guys to their fullest capacity.
Right.
Because I think a dental practice gets busy in the day-to-day stuff, and we see that quite a bit on our side. They get busy, and so there is nobody, and if there had somebody in the office, whether it's the treatment plan coordinator or the office manager, kind of say, you know what, we're gonna introduce this plan, and we're gonna get go back and forth with our existing patients, because it's really important, obviously, to keep your existing patients. It's the cheapest way to I mean, acquiring a new patient costs money these days, and it's
Right.
growing up. It's growing because competition's heating up. To keep your existing patients in your chairs and getting them to accept treatment, you need a strategy. And part of the strategy toolkit is, yes, obviously you're sending them emails about whatever you're offering, but part of it is going to be, hey guys, you have this going on, in specific messages, whether it's SMS or something else, or social media, to let them know that we care for you, we want you back, and we want you to do the treatment that you deserve, and here's another tool that we've developed for you.
Right.
To help you do that. So it's fascinating. I think it's all about education. One of the things we're trying with Constant Coach is educating, and this video would be seen by many practices across the country, and educating dental practices to look at the option. Just don't sign up for something that you don't end up using. Sign up for it and make sure that you hold your staff members accountable, team members accountable, for really developing this into a lead generation engine for you guys.
Right.
To generate more leads from your existing patients, leads as in new treatment from your existing patients, as well as new patients that are coming in the door, and utilize all the services that you're providing from a marketing standpoint. I think it's a no-brainer. People should be using this to do that, and not let a lot of practices I talk to, oh yes, we have Carrington, but does your team member, none of the team members know what that means. So hopefully we'll work with you guys in the future in developing some education materials that make all the team members understand what Carrington brings to the table. A lot of team members just don't know.
Yeah, you need to maximize the benefit of any relationship, business relationship that you have at your dental practice. And, I talked about the more traditional things that we do by helping drive patients into your practice, but there's another layer to what we offer our dental practices that participate in the Careington network. And that those are some healthcare savings on vision, so eyeglasses, RX. There's a whole suite of services that they get with that, and they don't have to pay anything for it. And it's for the dental, the dentists and their staff, and many times for their family. So you're absolutely right. It's important for all the team to know what the benefits are of these plans, and to really maximize it and use it. As you said, the dental practices are extremely busy, and a lot of what the admin team is doing is spending time on the phone or online with insurance companies trying to get claims approved. So even more so, the reason to get more of these patients on these plans that are straightforward, pay at the time of service, it's a win-win for everyone, and those are the best types of products and services, is when everyone wins.
It's a difference between doing what you have to do in terms of complying with whatever that you've already seen the pay, but how about engaging in revenue generation activities, and having this is part of marketing.
Right.
Marketing is not just advertising somewhere or doing pay-per-click. It's also about engaging your patients and giving them new options to accept treatment, and truly engaging with your community about, hey, we're here to serve you, and we have tons of options for you to get treatment with us. And I think Carrington is doing a great job in the practice that we have seen over the years. The practices that do use it as a strategy in terms of creating loyalty among the existing customer base and also generating new patients, they do add a significant amount of revenues to their practice just by caring, just by caring more about what their patients want. So this is very exciting. We'll definitely do more videos with your team in explaining all the different components of all the different plans, so that all the dentists on our network know that, hey, this is here for you to partake in, and this is going to help you grow your practice.
Well, we appreciate you having us here today, and we love what you're doing, providing this education to dental practices. It's so important. Education is the key to running a successful practice, and like you said, making sure everyone's on the same page. So you're putting a platform together where dental owners can know that by providing this content, the team can get on the same page and all be striving towards the same goal. So we look forward to being a part of this long term, and appreciate you inviting us to take part.
Thank you.